Good morning and welcome to the Fall 2011 staff meeting. Today is October 31st. Hopefully everybody here has an agenda. My name is Jim Dice. I'm one of the registered nurses here at Twin Oaks Home Care. Let's start with number one, and just so you know, the first 12 things are review. After that we'll get into some new policies and some current events that have taken place at our company here over the last 6 months. First and foremost, winter safety. As you know, the southwestern Pennsylvania, it snows here. We can get snow 7 months out of the year. It's October, and last night we had 6 inches, two nights ago, in this area. It's important that your vehicle is in shape for the winter snow. Make sure that you're driving a little slower than you normally do. My dad always told me it's not going that causes a problem, it's stopping. So if you're not going too fast, you'll be able to stop in time. And if any of you have been younger and you've driven, you've learned that lesson like I have. Make sure you leave a little bit earlier to get to your patient's house. Normally it might take you 10 minutes to get there. You might have to leave 20 minutes before. Defrost your windows, start your vehicle before you get out there, let it warm up. Safety is our concern, not just safety for the clients, but safety for our employees as well. There are additional supplies you may want to keep in your vehicle in case you get stranded somewhere until help can get to you. Make sure you have a cell phone in your vehicle. Check your tires, check your treads on your tires. If you're going to get new tires, if it's front wheel drive, get 2 new ones in the front. You know, that's where all your traction and your pull's coming from. I have in the past had studs on my Honda. When I was running around seeing patients, they work extremely well. Excellent traction. Some other things I wanted to mention about your supplies. Take a change of clothes with you. Make sure there's an extra set of clothes in your vehicle. If we're running a 24-hour shift and we get a really bad snowstorm, you're working 3 to 11, we may not be able to get you out of there until the next morning. That's only happened maybe 2 or 3 times in the past 11 years that we've been doing this, but you all need to know it can happen. Number 2, infection control. When we get to this time of the year, flu goes around. There's also the swine flu that's going around. Hand washing is the most important thing that we do in a patient's house. Make sure that we wash our hands when we enter, wash them before we leave. You don't want to take anything home with you. Wash them before you make a meal for them. Wash them after toileting yourself or the client, and before and after any wound care that we may be doing in the patient's home. We do have an infection control log we are required to keep at the front desk for any clients or employees that come down with any infections. That's required by the Department of Health. Adult diapers, one thing that employees have questioned here recently. Adult diapers should be double bag. Put them in a little Shop and Save bag or Walmart bag, tie it, put it, and then set it out in the outside trash. You don't want to leave that in the house. That's going to not smell very well. And you know, this past week on the news, they did some testing of things that we touch normally, and you would be surprised to see what made the #1 list as of having the most bacteria on it that we touch out in public. And that is the pumps, the gas pumps. I never thought of that, and I'm thinking to myself, wow, you know, we get gas at least once a week. So you might want to take some sterile wipes with you, and if you don't use it on the pump, after you're done with it, or maybe some gel, put on your hands afterwards. That's a real good point, you know. Number 3, daily flow sheets in the patient's home. We're having a problem when those sheets are coming in that the patient's name's not on the top of them. So any of the homes that you're in, we would like you to go ahead and write the patient's name at the top of the monthly flow sheet, and then all the daily sheets, write those in case one of those, we staple them together, but if one would ever get separated, we wouldn't know where it was to go. You also want to put the dates on there at the top. There's a section, and everyone knows we start a new packet the first day of every month. Like today's the 31st, tomorrow's the 1st. If today finishes on a Monday, tomorrow's a Tuesday the 1st, we're starting a brand new packet on Tuesday the 1st. Also, I have instructed the supervisors when they're out and they're gathering the papers, putting new ones in the homes, I want them to go ahead and write the patient's name on them too. But if they forget, then I'd like for you to be the backup and go ahead and write that on. Make sure you're filling out your shift that you're in there. If you miss your shift to fill it out, you will get a phone call from the ladies here in the office. You'll have to come in here and fill it out. Only because it's required for us to be able to bill Medicaid to show that we're not being fraudulent. There has to be signatures in place. There has to be the documentation in place to show that we are doing what we are supposed to do. Number 4, do us a favor, keep your purses in your vehicle. That's a big thing. We've had, not the patient, but the family members of patients take things out of employees' purses. There's also some homes that you go in, there might be some infestation problems. You know, when we work with, any time that someone tells us, you know, they're seeing some mice droppings or they're seeing some bugs in a home of some kind, or fleas, we get a hold of the care managers, we get a hold of the exterminators, we get them out there. But I don't want you to take anything with you. So, you know, check your clothes, check your shoes. Don't take anything extra in. You won't have anything to take back out. You know, if you only take your keys in, that's great. The other thing, your personal problems. You know, your dog died, your boyfriend left yesterday, your car broke down, and you got a speeding ticket. That patient should know none of that. That's all personal issues. You leave those at the front door when you go in. When you come back out, you can pick them back up and take them with you and work on your problems then, solve them then. It's not professional to take personal problems in a patient's house. Number 5, our annual TB training. TB testing is required annually on all employees. If you're a new employee, you'll get a 2-step. It'll be done the first time, and then the second part, it will be completed again between week 1 and week 3 after that. What you need to know is that TB has been on the rise in the United States, so we're doing everything that we can to detect it. That's what the shot is for. And then for the person to seek appropriate treatment. You have to understand that in some countries, as high as 3 out of 4 people have tuberculosis. That's 75% of the population. That's a lot. I'm not sure what the percentage is here in the United States. If you want to know, you could Google it. I didn't have time to do that, but I'm sure you'll find that it has been on an increase here in the United States. Once a person tests positive for TB, it means that they have been exposed to someone who has active tuberculosis. The cell will go into that person's lung. It will encapsulate, it will stay dormant. It may stay dormant the rest of the person's life. They may never develop active tuberculosis. If they do develop active tuberculosis, they would have to have the appropriate treatment and antibiotics, IVs for that. Once someone tests positive, which I've only had, you know, a handful of people in 11 years that have tested positive, they're never to get a TB shot again because the skin there will die. And they have to get a chest x-ray annually and keep it on file at their doctor's office to show that it's not active, that it's still in the dormant stage. Number 6, call-ups. Everyone runs into problems. Everyone has things that come up in their life. There are some clients' houses we can only send a certain employees in. Understand that if you do call off, we may need you to go to that house until the next person gets there. Or we may need you to show a new person what to do while they're there before you can go ahead on about your day. We ask that you help us in this area. It's not for us, it's for the patient. We ask that you help your patient in that respect. There are times when that may be possible. There are times when it may not be possible. We'll take each one of those issues one at a time. The other thing I want to mention here as far as call-ups go is we do require an 8-hour notice. If someone has been calling off and they're only giving us a 20-minute notice, that can happen a couple times, but that person will get a letter in the mail. And then when it happens again, we have to terminate their employment. Because what that does, if they're not going to be respectful to our staffing needs, what they're doing is they're putting all the other employees out there in a bad situation. Where you've already worked your 40 hours, and it's your day off, and it was the day that you had planned things to do. So it makes it tough on the other employees that are in that home. We're doing the best that we can to address that, and we have let employees go because of that very reason. We don't want to let people go. We want to grow, but we have to stay dependable to our patients. That's first and foremost. Number 7, schedule changes. This is, again, just a review. You must work your assigned shift. One of the things that we just found out, though, that is new, is if you failure to show up at a patient's house is now a criminal offense. If someone doesn't call us and doesn't go and has no excuse, it's called patient abandonment, and it falls under the Adult Older Services Protection Act. We want to prevent that from happening at all costs. There are some patients we take care of. They're diabetics. They have to have their meal. They have to have their insulin coverage. They have to be monitored during that process. I need employees to understand the gravity of this situation. I don't want anyone to go to jail for not showing up at a patient's house. That's why it's important that we communicate to one another. If there is an issue, if there's a problem, we answer our phones 24 hours a day, 7 days a week. We need to hear from someone if they can't make it to a patient's house. Any changes must be called into the office before you leave the patient's house. What happens is an employee is sent home early. Maybe they're supposed to work till 3. They get sent home at 2:30, and they think, I'll just call when I get home. They get home, and then all of a sudden, there's 3 other things going on when they walk through the door, and then they forget to call. That's why our policy is call before you leave the patient's house. And C, you must sign in and out correctly and accurately with black ink only, because we do weekly billing here. Failure to do so is also considered a criminal offense. If someone sent you home at 2:30 and you were supposed to work till 3 and you sign out 3 o'clock, that's called welfare fraud. That's also a criminal offense, and that's also punishable by law. Number 8, call the office with all patient-physician appointments. We like to know that ahead of time. That way we can let the employee going in there know that the patient has to go to the doctor that day. That way the employee can prepare for that appropriately. Sometimes we're transporting the patients. If that's the case, then the employee may need to take a different vehicle to make sure that the patient can get in and out safely. Number 9, returning phone calls. So like I said, communication is extremely important. If we're picking up a new client and we need some help, or if we're trying to cover a call off and we need some help, or if there's been a schedule change, it's important that you do have an answering machine, a voicemail, or for those of you that get text messages and your signal isn't really good, we will text message you to go ahead and call the office when you get a minute. We need to know yes or no. If we're trying to cover a shift, we need to know no, you can't cover it. So that's why it's still important for you to call us and let us know that, so we can move on to the next employee to get the shift covered that needs covered. Number 10, HIPAA. Well, what is that? HIPAA is the confidentiality, the Health Information Protection and Privacy Act. We need you to continue to understand, I know we've said this before, that patient information is strictly confidential. When you're discussing a client with any other employee, make sure that no one else can hear your conversation, or maybe use the first name only when you're discussing the client if there are other people around. That is extremely important. Number 11, the holiday rotation. We have some bigger holidays coming up. We have Thanksgiving coming up. Christmas Eve is separate than Christmas Day. That's 2 different holidays. New Year's Eve, New Year's Day, Easter, Memorial Day, and then we'll hit our spring staff meeting. You cannot make a special request on the holiday. It's understood that you're to work every other holiday. That's fair for everyone. If there is a holiday that you prefer, you are allowed to let the office know you prefer this one over that one. We'll do our best to accommodate, and I think our record has shown that we have done a very good job. Not all patients get services on these holidays. It may drop down to only 40% of our patients actually want services on the holiday. Well, that's great because only 50% of our staff are working that holiday. Number 12, office hours. This is also important for us to cover. Our office here is open Monday through Friday, 8 a.m. to 4 p.m. We are available 24 hours for any unforeseen situations that would occur. The phone numbers are listed there, 438-1936 and the 1-866-566-9214, which is toll free. If you live in Uniontown and you're calling the office here in Hopwood, don't use the toll-free number. We get charged for every toll-free call. If you live in Uniontown, use the local number, please. If it's an emergency and you're in a patient's home, dial 911 first, get the patient what they need, then let the office know what's going on after that. Okay, some new stuff. Number 13, your 2012 payday calendar. That you've been provided a handout on that. Employees are paid on the 15th and the last day of the month. The dates are there. If the payday falls on a weekend, it gets adjusted. If it falls on a holiday, it gets adjusted. Number 14, skilled services. As per the Area Agency on Aging, there are some clients that require insulin. We're going to be starting some certification classes for insulin preparation and administration. The registered nurses here will be able to bring you in, go over all of the important information that you need to know. The steps are there. This is the actual form that we're going to be using. You will be scheduled for those classes, and any of you that have a little bit of experience with that, that's great. There are some that do not. We just need to get everybody up on the same page. I will also be DVD recording that class, and we'll be able to show that here during the employee orientation. Number 15, notes left in the home still must be approved by the office. Employees must look at the patient's chart before your shift, and if there's a new note in there, please follow it. If there's a question, call the office about it. You must follow the directions stated on the note and call the office if there's any questions or changes. Number 16, for those that are transporting patients, we have to have a copy of your insurance. There is an insurance policy that we have. It's called a hired non-owned auto insurance policy. Now, I would say probably only 2% of our employees transport. So it's a very, very small number. We don't like to transport patients, but if they have no family at all around, we may be stuck in that situation. I would prefer that they send you to the store by yourself, but sometimes they do like to get out, and they need to get out. It's good for their well-being. Our policy is if you don't have a copy of that here, you're not permitted to transport. Number 17, the Safety Committee and the Performance Improvement Committee. These committees are set up and designed to look at any areas that could be a problem within the company. We meet on a monthly basis. It's 1 hour. If any of you would like to come in, it's usually at 1 or 2 o'clock. You get paid to come in and be on the Performance Improvement Committee. We review policies. Or the Safety Committee, we review the home safety inspection flow sheets that are done in patients' homes. Please let one of the office staff here know. We have to rotate employees on those committees every so often, and this is usually the time I mention that to employees if you're interested. If you'd like to get more involved, we would like you to get more involved. Here's one way you can do that. Number 18, Twin Oaks Home Care brochures, business cards, pens. I handed out some pens, some business cards, and we'll get you some brochures here. This is how we grow. This is how we get new employees. It's by word of mouth. We do an excellent job. People need to know about it. And if they don't hear from us, then we're not going to grow. So that's job security. So help us in the community. What I do is if I'm at a grocery store, I help elderly people put their buggies, I'll take their buggy back for them, I'll put their groceries in the car for them, and I'll hand them a card and I'll say, here you go, if you know anybody needs help, have them give us a call. I hope you don't need us for a long time. And they usually laugh and they go on about their business and they say, well, thank you for your help. Number 19, this is new and this is important. You all can pat yourself on the back for this. We've had our surveys recently. We've had 4 surveys, but the 2 biggest ones was the Department of Health survey. They came in on May 3rd. And the QMET survey, which is out of Harrisburg. That's the Quality Management Review Board out of Harrisburg. And they found us to be 100% proficient. It's difficult to get to that point, but you know what? It's difficult to stay at that point. And we're there because we are dependable and because we document accurately. So I know you might get sick of hearing it every staff meeting about the importance of documentation, but this is why. You know, we spent 2 weeks reviewing over 400 charts, making sure that everything was accurate, and it was 100% proficient. Not only did they not find any problems, they had no recommendations for us to improve. So that means everything that we're supposed to be doing, we are doing. Number 20, our Aflac insurance. Unfortunately, the gentleman couldn't make it here today, but I did want to let you know that we do offer the Aflac insurance for our employees. You have to be with us for at least 3 months. It's not expensive. The other thing I want to tell you about it is that right now, during this fall time, between October and January 1st, it's called an open enrollment period, which means people can pick up new insurance or add to their existing policies, or they can drop those policies. So I just wanted to let you all know about that real quick. Next, number 21 is an update on the workers' comp panel. You know, as we're required to have a group of physicians, if an employee were to get hurt, that they have to go see for the first 90 days of treatment. Well, we had an employee that needed an orthopedic doctor, and we had to add that on there. So that's a good thing. You know, it expanded. That way, if you or any employee were to get injured, we now have an orthopedic surgical group that we can refer you to as well. And they're local. They're right here in Uniontown. Next, number 22 encompasses a couple things. These are the new policies. First, you know, as technology increases and changes, we have to increase and change our policies as well. There's now a social networking policy. Our employees are not permitted to social network with clients. That's going to save a lot of headaches down the road. If you are related to the client, then it's okay. If you're not related to the client, then you are not permitted to social network with them. If you are a friend with them already, we ask that you go ahead and delete that. And that's pretty much it with that. It's cut and dry. You know, it's to prevent any further problems. It's to protect the employees down the road. The second one is the client no lift form. Right now our policy is if there's a patient on the floor, 911 must be called, or the family can pick the patient up off the floor. We are not permitted to. If that occurs, there is a $200 fine associated with that. If that doesn't work, then it'll double. It'll go to $400. If that doesn't work, it'll double. It'll go to $800. I do not want any employee hurt picking up a patient off the floor. The next new policy is the alternate transportation policy. We have employees from time to time whose vehicles break down. Well, we live in a county that has alternate transportation. The FACT bus, and in Greene County, there's the Greene County Transit. We provided you with the phone numbers, so there's no excuse as to why you can't get to work and back. The phone numbers are there. There are some days where they do not run transportation. Those days are listed there as well. If you have any questions on that, please check with the office regarding the transportation. 2 more handouts there, one on special request. What you need to understand is that a special request must be 14 days or more in advance. If you request a certain day off and it's less than 14, we can't guarantee that you're going to get that day off. The best thing to do is to, if you have appointments, if you have doctor's appointments, make those in advance and get those into the office here so we can schedule around it. And we will do that for you. Our schedules are done a week ahead in advance. So, you have the schedule that we're in, we have the next week's schedule, it's already done. It's ready to be called every Wednesday. And the last one is the child abuse clearance. If you are in a home, the Department of Health now requires, if you're in a home and there is a person under the age of 18 in that home, that we do a child abuse clearance on the employees that are in that home. If you're not in a home where there's not anyone under the age of 18, we're not going to do that child abuse clearance on you, only because it wouldn't be appropriate, and it costs a lot of money to have that done. We pay for those to be done, so we're not going to spend all that on. We'd rather give you a raise. Okay, last is the annual competency test, which we're going to go ahead and complete at this time. And I thank you for your participation today. Have a great day. Bye-bye.